was found that PRFI was way better than bad in predicting post-LASIK ectasia. Also, machine learning model was compared with conventional methods of person tissue ablation and Randleman ectasia risk scoring, and it was found that the machine learning model was better. It was correctly able to reclassify patients of post-classic ectasia as ectasia risk group on the basis of pre-operative data that was available and fed into these algorithms. Now, AI has also been explored in infectious keratitis, where these algorithms have been correctly been able to identify corneal ulcer and also the type of corneal ulcer. It was observed that the diagnosis with these AI-based algorithms was found to be better when compared to clinicians. Also, the specificity of these algorithms for fungal keratitis was way higher when compared to bacterial corneal ulcers. It not only identifies corneal ulcers but also assess the disease severity based on the measurement and assessment of size of the corneal ulcer. And because it is able to assess the size of the corneal ulcer, it can also assess the response to therapy, medical therapy that is being given to patients by assessing the serial clinical photograph result. Now, this is a study by Patel et al. Where they reported the measurement or assessment of size of the corneal ulcer with artificial intelligence. You can see that the ulcer was monitored serially serially with artificial intelligence. And in fungal keratitis, it has also been put to use for assessment of results of confocal microscopy. As you're aware, the confocal microscopy results are provided in multiple section images, and each image needs to be analyzed closely to give appropriate and good results. An automatic detection of these sections, especially when detecting hyphae in cases of fungal keratitis, can be extremely time-saving and can reduce the workload of the healthcare workers. Now, various other corneal pathologies where AI is being explored are dry eye disease, wherein ASOCT images have been used to assess the thickness of the tear film. Frontal eye videos have been used to assess the tear breakup time. Tear film lipid layer interference images have been used to assess the lipid layer breakup patterns to compare evaporative to assess and diagnose evaporative dry eye when compared to aqueous deficient dry eye. In Fuchs dystrophy, deep learning algorithms have been used to identify early Fuchs dystrophy where there is only descemet endothelium complex thickening without any evidence of corneal edema. In pterygium, AI has been used to identify pterygium, its location, and also its size. Pterygium net is one of the algorithms that has been put to use for this assessment of pterygium. Some authors have also reported use of AI in assessing post-DMEC graft detachment, wherein the artificial intelligence algorithm automatically assesses the ASOCT images and identifies even minor or shallow detachments of the DMEC graft. So these are the areas where AI has been used in corneal diseases. However, the major limitation is that there are different algorithms and softwares for assessment of each of these diseases. A single software that can assess multiple diseases altogether and in the same software is something which can be most beneficial to the clinicians. A similar software was developed by Elsevier et al., where a single image of ASOCT was assessed by these deep learning neural network algorithms and identified dry eye disease, Fuchs dystrophy, and keratoconus, all three with the help of single ASOCT image. So development and refinement of such softwares in future is something which will be most promising for clinicians to use in daily practice. Thank you.
Thank you.
The topic. The last part of the topic and your slide is that you can, there is this algorithm has come Okay, one picture will diagnose multiple diseases of cornea. It is very exciting. Can you highlight something?
Sure, sir. Currently, there is only one study which has reported based on ASOCT image
Mm,
on how to detect keratoconus, dry eye,
mm,
and Fuchs dystrophy. So, definitely, if we have some of these more refined
mm,
softwares that can come in, it will be really useful. But unfortunately, it is not just one imaging that can help you in identify other
mm,
all diseases. You need pentacam, slit lamp photographs. So, we need to amalgamate all these things together to develop an algorithm that can ultimately identify or categorize the patient's disease, whether it's a dystrophy, and identify the kind of dystrophy the patient has or the kind of ulcer. So, if we can put in all these slit lamp images, pentacam, and ASOCT all together, and then ultimately come with a combined software, that's going to be really helpful.
mm. And another thing that within the diagnosis of keratoconus, you have shown that there's a distortion of eyepiece, and how it will help in how much percentage around it will be helpful if this type of algorithms comes, whether it is very high accuracy or not.
Yes, so the sensitivity and specificity, as we already saw, is more than 90% with AI to detect
Mm,
form frustrae keratoconus. So
mm,
definitely that is something really useful,
mm.
because everybody who's into a refractive practice may not be a cornea specialist, may not be reading the pentacams as closely as a cornea person would do. So if they have a software handy with them in which they can just feed in the software, it's going to be really helpful both for the clinician as well as the patients.
Uh, and what about the Pentagram results and your algorithms? Can it be comparable?
The pentacam algorithm, pentacam, pardon?
If you are using the Pentacam,
Yes.
whether keratoconus diagnosis will be as accurate as your
It's better. The diagnosis is better.
yes,
The results of AI are always better compared to the human diagnosis,
mm,
because Pentacam has innumerable values and numerical display.
yes,
For a person to read every value very carefully is sometimes you may even miss out subtle findings. But AI is not going to miss out, because they are
yes.
going to read every point set, data set is going to be taken into account.
Because it is a very important point, because we are many times fail to detect the keratoconus, and if it is algorithms comes with the artificial intelligence, it will diagnose very easily, and it will be helpful for the screening purposes. And also it predicts the future keratoconus uh, diseases of the if it can develop in the patients.
A lot of
It is
patients are, it's also important for corneal ulcer, as we saw the
yes.
predictability with a doctor predicting the type of corneal ulcer
Mm,
on the basis of clinical judgment is just 60%. But the AI, the predictability is up to 90%.
yes.
So, especially for who are non cornea surgeons, general ophthalmologists practicing in periphery, if we have a software like this and they can just feed in a photographic image, even taken with a good smartphone, and compare, put it into the algorithm, and they are given good results, the patient can be spared from the cocktail therapy that they usually receive in by the general ophthalmologist.
Okay, thank you. Thank you for your great presentation.